Thank you very much for having me here today, and thanks for letting me be part of the first annual healthcare conference. There are few issues as important and probably as all-encompassing as healthcare. I will tell you, I raised my hand when Linda asked if you're up at 4 this morning. It was because my son had a tummy ache, and I was up most of the night with him. Had I known the wedding was on, I would have turned it on so we could both go to sleep. That would have been the difference right there. A big fan. I'm a big fan of the royal wedding. No, not. But perhaps one of the points at the end of the day today, you may, in effect, have more questions than answers. I think as you listen to the panelists throughout the day, you'll understand there is a great deal of uncertainty about health care and where its future is in America today. And you'll hear this, I think, throughout the panels. What I think is perhaps most frustrating is how a health care system that performs such miracles each and every day. There's probably not a one of us who doesn't have a loved one or a friend alive today because of amazing medical technology and treatments and response. Yet today that same healthcare system is under perhaps the darkest cloud of uncertainty since its inception in America. And I think the reason for that is that whenever government tries not simply to improve something but to remake it in its image, you're going to see real problems occur. And today, you're going to hear about some of the real concerns going forward. You can't talk about the future of America's health care and our economy without talking about our financial situation. You've seen this chart before. This is our financial future as a country. The way they compare nations around the world, their financial health, is look at how much they owe in comparison to their economy. That's sort of the apples-to-apples comparison. Here you can tell in 2010, we're at the highest level of debt according to our economy since World War II, and it's just getting started. The path forward, if America doesn't change its ways, is unprecedented in our history and has severe consequences for all of us going forward. What drives a great deal of our spending going forward is not simply traditional thoughts of government like border security or education or veterans care or air traffic controllers or roads and bridges, but our three main senior and health care programs, Social Security, Medicaid, and Medicare, because we have some 10,000 seniors a day entering Medicare and Social Security, because the President's new health care plan moves so many Americans into Medicaid, just changing that program dramatically. These costs continue to soar. In fact, in not too many years, those three programs alone will eat up every dollar of revenue coming into Washington through our taxes. This is the new healthcare system. Well, this isn't the whole system. It's 1/3 of it. We couldn't fit it all on one organizational chart, but this is a page-by-page, provision-by-provision, very careful, delineated organization chart of the new healthcare system. I'm not going to go through it because we've done that with you before in the past, but it raises so many questions. The President really sincerely believes that this is the answer to our financial problems going forward on Medicare, health care, and Medicaid as well. But there are so many questions that are being raised today. Businesses are concerned about what these new mandates will do to drive up costs. Businesses are running the numbers to figure out, because the incentives in the bill, in many ways, for some companies, it is much cheaper to drop the health care they have today and move their workers into the exchanges. And as they run those numbers, in fact, the comparison really isn't close. I think you'll see companies, you're seeing businesses actively figuring out how they can stay under the 50 worker threshold so they're not moved into the programs and mandates. I think we're going to see among companies from 50 to 300 employees, I think the bulk of them will drop their plans if they have them today and move into the exchanges. Our biggest worry are the larger employers who traditionally have had very robust health care plans. But when they run the numbers, under the new system may well see that they can't justify continuing health care, employer-sponsored health care. And so they have a great deal of concerns in small, medium, and mid-sized businesses. Healthcare providers concerned about the $500 billion of cuts that are included in ObamaCare, and those cuts in Medicare predominantly are used to fund the new program. They're concerned about future rationing organizations, the Independent Payment Advisory Board that will set the rates for treatments and in effect limit the types of treatments that are available. They're worried about the models that the government will force them to move into. And I talk about that because we have in Texas, and especially in our region, we have extremely successful models. Some of them are academic, some of those are for-profit, non-profit, some are physician-owned, all of them work. And in a state like ours, which has so many unique characteristics, each of those models fits their unique region. But under the ObamaCare model, our healthcare providers have one foot in the model they have today and not sure where they're going to put a foot down in the future. They're concerned about new rules related to accountable care organizations, which is one of the new models under the President's new health care plan. Hospitals are concerned about cuts, skilled nursing homes, home health care agencies, even hospice care agencies are concerned about future cuts and the impact on all the new Medicaid patients coming into the system. Physicians worried about just fair pay for seeing Medicare patients, as well as prescriptive new health IT regulations by the Fed. States concerned like Texas, concerned about a flood of new Medicaid patients as a result of this health care, because more than half of all the new coverage under the President's new health care plan just moves people into Medicaid, which frankly is not one of our best models in healthcare in America, and pays at a terrible rate to local providers and really isn't sustainable. But states are trying to figure out in this financial climate how they can afford to take on those new Medicaid patients. Providers who see those Medicaid patients see future cuts coming their way as well. States are also dealing with deadlines by the feds for exchanges and a number of other changes in healthcare delivery at the state level. We're all concerned, I think, about the new regulations that will be coming forth. This really is just the framework of the President's new health care plan, because each of those is driving out regulations that define what this new health care plan is. And all of those regulations and mandates have dramatic impacts on the cost of health care and the delivery of health care locally. We're all watching one of the guaranteed benefits package right now. Guaranteed benefits package right now, because that will define what government-approved health care means in America and will drive a lot of the future costs of health care. It will be the mandate that businesses, that states, that governments have to live under in providing health care to workers. And so we're all following that very closely. Seniors are concerned about being forced out of their Medicare Advantage plan, which about 7.4 million seniors will be forced out. They're worried about not being able to see doctors close by or have community hospitals because of cuts. Patients overall are just worried about how much more will government be involved in the doctor-patient relationship in the future. Insurance companies concerned about the new mandates. Many of them are laying off workers because government has decided what the government definition of medical loss ratio is and what administration costs really ought to be, which our healthcare providers already know how Washington can get that wrong. And so there are just questions after questions after questions moving forward on the President's health care plan for the future. This is the real cost of healthcare overall. The reason I started with the financial side is because it's such a big part of healthcare going forward. The total spending increases the first 10 years are $1.4 trillion. But if you really, because the way this healthcare is stair-step, the real price over the first 10 years is about $2.5 trillion, much of it on top of the debt and spending we already do today. And the administration has already admitted this will not lower health care costs. It will not lower federal spending. In fact, it drives both of them up. So in this perilous financial situation we're in as a country today, the President's new health care plan is a real concern. Republicans feel strongly this is the wrong solution, that we need to take a step-by-step improvement to health care, starting first with making it more affordable, giving people more choices, driving medical malpractice costs out of the system, allowing competition across state lines, protecting those with pre-existing illnesses, protecting those young people who need to stay on their parents' health care longer, obviously, but providing more choices. And I always like to remind people of all the ideas that were presented during the health care debate. Only one got voted on, the President's plan. But our alternative was the only plan that actually lowered health care premiums by 10%. The only one. Now, that doesn't change the world, but every dime we can drive health care costs down and keep the quality up is important. So these costs matter. Obviously, we have in the House, we've already moved to repeal Obamacare fully and completely. It was the first bill we passed out of the House. In the second bill we passed out of the House, we had 8 amendments that repeal specific provisions of it. We will continue to do that. We did succeed in repealing a $17 billion provision, often called the 1099 provision. There was a new paperwork mandate on businesses that was just onerous and, completely unacceptable. And the President was forced to sign that. But you're going to see a real battle going forward. It is going to be difficult to repeal the President's health care plan, mainly because it's the President's health care plan. This is a quote he said. I said, you want to repeal health care? Go at it. We'll have that debate. You're not going to be able to do that by nickel and diming me in the budget. You think we're stupid. And that was his discussions with Speaker Boehner. So clearly, as the House leadership and myself and the President just see this issue differently, and we're going to be butting heads for the next 2 years, which I think is absolutely necessary, but also adds uncertainty as we go forward in this whole process. Let's talk about why Medicare and Medicaid are growing so fast. I always have to wrap Obamacare, the President's plan, into this. Cost of health care is skyrocketing. An aging population is leading to record Medicare enrollment. The economic downturn is leading to record Medicaid enrollment, and we're going to continue to see that as our baby boomers age. A choice of two futures. If you look at the direction we're going versus where I think we have to go, we're really at a crossroads. Under the current path of debt, as far as the eye can see, Republicans recently passed through the House a budget called the Path to Prosperity. And it puts us on a different path. And the reason I feel so strongly about this budget is that its goal is simply not to balance the budget. It is to pay off the debt. Think about it. It's not just to go back to break even. It is to pay off the debt, and that is because our debt as a nation, it has grown so large and uses so many of our resources. It's like in your home or like in your business when your debt load is that big. That's where your resources go. Instead of your own growth, your investment, your own dreams as a family, we're in that position already as a nation. So it will not happen overnight, but setting that goal of not merely balancing but paying it off is exactly the right goal going forward. It makes tough decisions as we go forward, but really it's focused on taking the size of government back to 2008, a little below 2008, before the stimulus, before the bailouts, holding it there for about 5 years, and then letting it grow from there. But we also tackle reforms in Medicare and Medicaid as well. In fact, let me go here. Medicare reform, you're hearing a lot of scare tactics. I picked up the Wall Street Journal earlier this morning and saw another one by Don Berwick on it. But Medicare continues to grow. It's unsustainable. The trustees of the Medicare program have already said we may face insolvency within 10 years. So the worst thing we can do for seniors is to do nothing, is to delay making the reforms and the changes to make it solvent. The President has failed to lead on this. I think I think our past speaker and others have failed to lead on this. We're going to lead on Medicare, whether it's politically popular or not. But the way we do it is to ensure, one, that we don't make a single change to anyone in Medicare today or anyone planning to go into Medicare for the next 10 years. So if you're 55 years or older, your parents are Medicare, your grandparents are Medicare, there is no change whatsoever. Sit back, relax, you have Medicare exactly as we have it today. But for the next generation, for those who are 54 and younger, who it won't be there for them unless Congress acts now, we make some changes. We use the model that, two models really. One of them is the way federal employees get health care, where they have a broader range of choices by private plans. But we use the Medicare prescription D model, the Medicare medicine model, where after 2022, the new people coming into Medicare will have a choice of a broad range of programs, like we do in Part D, the drug program today, where they will pick a plan tailored to them, to their needs, not to Washington's needs bill. And then the government will pay those premiums. You'll share in the co-pays and deductibles just as you do in Medicare today. But that simple change in providing greater choices and greater competition drives the cost down over time. Medicare still increases, but it increases at a level that's sustainable, not just for this generation, but for the next generation, the generation after it, and gives you choices that we don't have necessarily throughout Medicare today. We also take back the $500 billion Medicare cuts that was diverted to use for the rest of the program because we repeal Obamacare as well, comes back to the Medicare side. I should also point out that with this model of Part D model, we'll be able to give more help to the premiums for people who are low income, haven't had skilled jobs, low fixed incomes. And in fact, we'll be creating a medical savings account for a lower income seniors, so they can get help paying their co-pays and deductibles and preventative care as well. So it's a plan and a program we know already works. In fact, the Medicare Part D program is the only new government program under Medicare that actually came in under budget, 40% under budget. And it's because it wasn't government delivering services, it was the free market competing for seniors' business rather than just a one-size-fits-all approach. For those who say Republicans will end Medicare as we know it, here is the Medicare spending over the next decade. Clearly, we're not ending it. In fact, it's growing as the senior population grows as well. Medicaid reform, you saw in an earlier chart, Medicaid is one of our big drivers of costs going forward. Very important program for the poor as well as for those going to nursing homes at the end of their life. But that Medicaid is at such a rate, not only I think will it drive the U.S. government closer to bankruptcy, but it's doing that at the state level right now. Not just Texas, but every state is struggling to figure out how they pay for Medicaid. Texas is a great example. When I was in the state legislature, I think Medicaid was 2% of our budget. Today, it's almost 30% of Texas's budget and growing. It's squeezing out education dollars, healthcare dollars, law enforcement dollars, because it continues to grow at both the federal and state level. What we're proposing is what our states have asked us to do, which is cut the strings, give Medicaid and the programs back to the states. Let them each state design a healthcare system tailored to their state's population, their size, their demographics, their growth. By doing that, not only do you control costs going forward at the federal level, but you allow states to do the tailoring, come up with the innovation, develop the programs that work for them, not for Washington. The grants, block grants, are based on 2012 funding levels. They increase about 4% a year and account for population growth. Obviously, states will be free to set their own Medicaid rules, working with our local health care providers. And of course, we repeal the new Medicaid expansion as we go forward. This is, I think, a common sense idea, long overdue, but critical in health care delivery going forward. The cost of waiting. You often hear this in Washington, really there's no problem with Medicare or Medicaid. Don't touch it. And a lot of politicians will tell you that. But the cost of waiting is real. These are if we had to come up with the money, if we were a business, had to come up with the money to make good on our promises as a nation, this is, I think, Medicare or Medicaid, perhaps Social Security in there as well. 2009, what we'd have to write a check for, come up with, is almost $63 trillion. Just by waiting 2 years, that check is now almost $100 trillion, which we don't have a dime of that, by the way. Every year we wait, it's just like in business, just like in your family. Every year you put off a problem, it only gets worse. And this gets worse in a hurry. So we're going to lead on this issue, political consequences or not, because we can't afford to delay any longer as a country. This is, I want to finish up here with a couple slides. This is our budget, by the way, at the federal government. It's not always what people think it would be. The yellow, I believe, my first and foremost constitutional responsibility to you is to keep our country safe, to keep you, your families, and our nation safe. So we pay for defense in a major way in this country. The second part that people think about government is the rest of what's called discretionary, which means the yellow and the green pies are what Congress allocates each year. We fund them each year in 12 bills. And this would be border security, air traffic controllers, roads and highways, education, issues like that. The president's often said we need to freeze this, but as you can tell, that's not enough. That's such a tiny part of our overall budget. To balance it and to begin paying it off, we've got to figure out innovative ways to stretch those dollars further going forward. In fact, all this area here is what's called mandatory or entitlements, but bottom line is they're on autopilot. We don't appropriate or fund them each year. They're done by formula. They just go. And as you can see, 2/3 of our budget is just on autopilot. Now, in your business and in your family, you couldn't deal with that because that's the part of the pie that continues to grow going forward. And again, has already eaten up most of what the country's budget is today. We're so far out of whack. I always remind people, literally, we could double everyone's taxes in America. We wouldn't balance the budget. Our spending is so far out of whack. We've added $5.5 trillion of debt just the last 4 years. We're in that red cautionary zone where if our debt gets much bigger, our economy starts to slow dramatically. But if we were to force the government to balance its budget this year, the spending is so far out of whack, we would have enough money for Social Security and Medicare and Medicaid and pay the interest on our debt. We'd have enough to do about half of this. This would be food stamps and some of the welfare programs. But you could shut down all of our defense, send every soldier home, shut down everything from roads to air traffic control to Veterans Care and Border Security, about half of that, because we wouldn't have the money to do it. That is how deep our deficits are running today, which is why heaping more health care costs in the new program on top of this just seems amazing. So the forecast going forward, just to depress you a little more on this Friday morning, the English wedding lifts you up. Let me bring you down. More regulation. We're going to see more regulation just blowing out of Washington over the next 2 years. You're already seeing it in many ways today. It's going to be a major concern for all of us. More uncertainty as we go forward, not just because of the plan, because there is a real difference in vision which way this country ought to go, and you're going to see it played out in the budget month after month going forward. There's going to be greater strain on the federal budget, both with traditional health care, Medicare, and Medicaid, as I showed you, and obviously with more baby boomers retiring, we have to have the infrastructure. You have to have smart, innovative ways of providing health care we don't do today at the government level. So, like a business that's in deep financial trouble and has to find a better way, a smarter way, a more innovative way to stretch their dollars, the government needs to choose a different path going forward, a different path as a country, both financially and to deliver health care. So, Linda, please hold your applause on this. I'd be glad to take questions going forward. Yes, ma'am. What is the biggest hurdle getting your plan through the Senate you think that will change during the election year? The biggest hurdle is obviously the Senate is held by the Democrats. The president has a veto pen. They see they're strong supporters of the president's new health care plan, and so my guess is we're going to move a lot of legislation through the House. It's going to be briefly battled and then die in the Senate. The biggest hurdle is the Constitution gives the Senate and the White House itself a veto pen. And so in that constitutional process, we're short the votes. It can change after the next election year. If the Senate changes and the White House changes, clearly there's going to be a path open to make some serious changes. First reaction to the chart, do they deny this chart? No. In fact, every provision on the health care chart, it has, if you look at it closely online, every box and every line has the exact provision of the law that it references embedded in it, so you can check it that way. Reaction to the Republican reaction to the chart. Obviously, we did this because we wanted the country to see what the new health care law looked like. I think most of the population looks at it and just sees a bewildering organization and don't see themselves as patients or small businesses in that health care chart in a healthy way. And so I think it did help at least lay out just how complicated and bewildering and complex this whole new healthcare law is. And that's just the start.
Just two more.
Come on. What is the status and update on claiming parents, senior citizens, on our own health care plan as dependents? I'm not as familiar with that. If someone's wants to grab me afterwards and visit with me about that, I'd be glad to follow up on that. Do you foresee this option becoming available in the near future? That's new on my radar, so again, let me visit with whoever has this idea. I'd be glad to do that. We'd like to think the Woodlands, in general, is a progressive community. In your opinion, how do you think the local healthcare community can impact and prepare for these changes? They already do and have and are as we speak. I know I serve on Ways and Means, so we do a lot of healthcare issues and all the tax incentives on healthcare, including from bringing new drugs to market to the insurance plans that are deductible for companies, including your health savings accounts as well. So we're involved in it a lot. Our local healthcare community is so accessible to me. We meet regularly on healthcare, on delivery, on cost, on what the new regulations are. Our healthcare communities frankly are ahead of the game in aligning doctors and hospitals and providers together with the patient to try to deliver better service and quality service at a lower price. We've got here in the Houston region, Montgomery County, I think some of the best models in the nation on how to deliver health care. The problem is no one's listening to our local health. Up there is listening to our local health care providers, the models that are in place today, and that's the problem. Washington does this all the time. I can tell you from experience. They pick one idea from one area and then they apply it across the country, whether it fits across the country or not. Healthcare really ought to be coming from the local community up, because every region, every state, dramatically different. Demographic, size, geography, the models that are there in place today. We ought to be boiling this up from the top, or from the bottom, not from the top, and we ought to be taking it step by step, carefully, which is exactly what our local healthcare providers have been telling me now for years, which is do not overlay this huge government vision of healthcare on top of a system that, yes, needs improvement. Yes, we need to be able to have better or more affordable care, and there's ways to do that. But oftentimes it is the government that's the hurdle in between quality care and affordable care. So I guess I'm not trying to build up our local healthcare community beyond recognition, but I'll just tell you from my standpoint, we have models that work, and they're battling, I think, new regulations and new mandates that don't improve that system, but I think hinder it in a major way. Let me think. I'm going through my library of things that would cheer you up. I save 15% on my car insurance. I don't know. Not sure that would work. Look, we have some big challenges ahead of us. There's no question about that. But the solutions really are here at the local level. And in our region, with the Texas Medical Center, with sort of the cutting edge, really the cutting edge healthcare providers in the systems in the country, we have the solutions back here. Our battles aren't partisan, really. We really have much different visions of where we go forward as a country. You know, where you put your faith and your responsibility and your dollars. You know, and who makes the decisions, patients and doctors and local providers versus Washington or a bureaucracy or a new independent payments group that decides when the government runs out of money, these are the treatments that will be paid for and these are the treatments that won't be paid for. You know, we just see a different vision. We need to continue to push for local solutions on healthcare, on a whole host of issues. We do that, we're going to be in good shape. We're going to have exactly the vision, but we're going to have to tackle the tough financial decisions going forward. I'm going to need your support in ensuring that Congress doesn't delay any longer, in whether it's Social Security or Medicare or Medicaid. You know, I just think the country is ready for truth tellers. We'll tell you exactly the situation is, give you the ideas on how we move forward, and then do it. Like in business, like in your job, produce results, go after the solutions. If they all don't work, fix them and go forward again. We can do that. Thank you very much for having me.